Hello, this is the first of 4 videos to explain how we do medication reviews at Lockside Medical Centre. I've got the t-shirt on. So this video is made in 2020. It's dated because I have COVID lockdown hair, unable to get to the hairdressers. So medication reviews at Lockside Medical Centre are complex. And they're complex because not only are the medication review due dates connected to the medication, but also to the patient's condition. So when you carry out a medication review, you also are carrying out a review of the patient's conditions as well. Of course, as we know, many people have lots of medical conditions and take a lot of tablets. So a medication review at Lockside involves having a knowledge of the monitoring regimes of different medications and also the protocols for conditions, and that often involves knowing a bit about cough as well. And it also involves having a knowledge of getting around the templates, especially the medication review template and the disease modifying drugs template. So we do medication reviews because it's a major part of our clinical safety. And it also is part of our clinical recall system. So we can't have people with long-term conditions not having a recall system because they need monitoring, and our medication review system does that for us. And there are many opportunities of when you can do a medication review. So there's a pop-up window in the lower right-hand side of the EMIS screen that comes up red saying medication reviews. And you've probably seen them all the time. And you'll see them when you're consulting. You'll certainly see them when you're signing prescriptions. And also, especially when you're looking at letters and also results. And those are all ideal opportunities to do a medication review. Now, there are many to do every day. There are probably 100 or so medication reviews to do every single day that we see. And this takes up something close to about 3 to 4 hours of clinical time every day. And if we didn't put that much effort into it, then everyone's medication would be out of date and we wouldn't have an effective recall system. So every medication review diary date, so if you look in the diary function on someone's notes, has a description of what tests are due next. And that's been put in by a clinician when they set the medication review. So when you do a medication review, it's not just ticking a box and saying medication reviewed, but you then have to set a date in the future and also state what tests are needed next. So for example, if that's high blood pressure and the blood pressure is well controlled, a bare minimum is you need to test that blood pressure again in 6 months' time. Now, there are many different ways of looking at the screen to do a medication review. And one of the ways that most of us do is the first thing we start is we look at the diary entry. What does the diary entry say is due next? So when you see that little red pop-up on the screen, what is due next? Have a look at the diary thing and it will say things like blood pressure due or MOT due or blood test due. The next thing is then you have to gather some information, and that involves looking at 4 different sources. The first of all is have a look at the patient's problem list. What conditions do they have? Also, have a look at their medication list, what medication they're on. Have a quick look at their results section. So have they had the recent tests necessary? And also you may need to look in their consultations as well. Some people, for example, ignore requests to come in for their medication reviews. And it's important to know that when you're setting a medication review date. Then you need to apply your knowledge of the protocols and the practice, and we'll do that in the next video, I promise you. And then take some action. So every time you see a medication review overdue, just take some action. And that action may be fantastic, all the tests are done, the patient's safe, I'm happy with the medication, set a new review date in the future using the protocol, and describe what that medication review is to entail. Or you could contact the patient, you could pick the phone up and talk to them, you could send them a text, you could send them an email, or you could pass their patient those details onto the clinician who knows them best, because sometimes the medication reviews is a judgment call, and we've seen that especially around things such as skin conditions or mental health. But always take some action. And one action you could take is the patient's had loads of reminders, hasn't been in for tests, it's getting clinically unsafe, and therefore you stop their medication. We do that very rarely, but say someone's not been in for, say, 4 months with their warfarin, it's pretty sensible to stop that drug. So the next video, Joanna will show you how to do a very simple medication review on somebody who has hypothyroidism. And we're using dummy patients here, we're using the duck family.